my own personal style is try to create excitement around the vision and to constantly be asking our staff and colleagues to help us figure out better ways of doing things. And I think this inclusiveness and sharing responsibility for what we're doing, where we're going, is one of the things that I think is helpful. But I don't know what styles there are to choose from, but that's more or less the way I function. Well, there's a lot of experiences that have been pretty meaningful to me. And first of all, I must say that some of our work on a national advocacy basis has been really, really exciting. I was involved with the Clinton White House originally in the early 90s when they came into office on health reform, but which of course didn't succeed. But back in '97, when the state Children's Health Insurance Program, or CHIP, was developed, we were very involved in that, and I think played a role in helping to make sure that got accomplished. And that kind of thing was very, very meaningful to me. I had a role in making sure that Elian Gonzalez, the young kid from Cuba who was being held hostage by kind of a fanatical family or quasi-family in Miami, I worked with the U.S. Attorney General to make sure he got back with his dad and all that. But I think the biggest sense of accomplishment, the thing that's my favorite set of experiences really has to do with being able to attract absolutely fantastic people around me and the programs that we're running. So that the medical directors of our programs here in New York and nationally are spectacular. They're pediatricians that are as good as any I've seen anywhere. Kind of really the kind of doctors I would have been proud to have for my own children or grandchildren. So looking back on things, assembling really a team of hundreds of people now across the country that we work on these programs is really profoundly satisfying. And finally, the actual accomplishments of delivering services to kids who had a great deal of difficulty getting services. We're doing about 260,000 healthcare encounters a year with very indigent, homeless and other poor children, has been a rewarding experience beyond my ability to describe it adequately. So those are the kind of things that keep me going, and very, very proud of what we've accomplished. Advocacy is a very slow and painful process. This is something that you kind of learn after years, and to the point where a lot of people get discouraged and stop doing it. But, if you do 15 advocacy initiatives over some period of time and 2 are successful, that's not bad. So you have to have a tolerance for not always being successful. And what I would like to see is a lot more people who are involved in advocacy, who understand what the needs are, who develop new skills for making sure that public policy reflects the right things to do. This is actually, it rarely happens, and we have a lot of policies that are leaving people out, marginalizing children, and not responding in a variety of ways, and that's unfortunate. So I'd like to see the field get better at doing what it needs to do. But it should always be remembered that a physician's voice in advocacy circles, if it's played right, is very, very powerful. And so choosing wisely what you're going to focus on is important. And I think that's something that will evolve as time goes on. Well, my general advice is, as I said earlier, that number one, be a really, really good doctor. Know your stuff. Know how to deal with patients. Know how to be humane and caring. Know how to make people feel comfortable. Know how to include patients in your decision-making, in your interactions, and be aware of the fact that what you do is important and it's part of a mosaic of services and support that families need. You're there as a teacher, a role model, and all of that is part of your basic skill set, hopefully, and that will drive everything else. As far as being advocates are concerned, whether you're an advocate on a local community level or with patients, or whether you're doing more regional or state or national level advocacy, the point is that remember your roots and understand really what's in the patient's best interest, and try to learn from mentors who have been out there and been successful. I've had mentors all my life. I still do. And, paying attention to what works and how to keep your head on your shoulders and sticking with it even though there's going to be failures and stumbles along the way. The other thing I think is really important for doctor advocates is to be as familiar as possible with basic public health principles as you can. If it was up to me, I would not let anybody into medical school who didn't have some very significant grounding in public health, either an MPH or some sort of bachelor's level, undergraduate level programs and courses in public health. Because understanding the big picture, the population drivers of healthcare, the non-medical issues that really do affect health, water, the environment, poverty, access to education, and so forth. All of these things are phenomenally important, and people who are on a straight line from a science-based pre-medical course to medical school, straight into residency, sometimes don't have an opportunity to understand how incredibly important those other factors are in actually producing health, and in many cases, way, way beyond the actual medical services that we provide. So pay attention to those public health principles and try to get yourself familiar and comfortable with them as you possibly can.